All right. So in the previous lesson, we discussed the fact that some of our practice is governed by evidence, right? So we talk about evidence-based practice and the concept of research. And in today's lesson, we're going to focus specifically on research strategies. And my intent is to get through the observational strategies, the correlational strategies, and perhaps, depending on time, we'll get through some of the experimental pieces. But there will be a second lesson that will cover developmental paradigms, as well as the concepts of reliability and validity, which are incredibly important. But without further ado, let's get into it. So can everybody see my screen? And yes, no?
Yes.
Yes.
All right. So as I said, research is at the heart of everything we do as a psychological science. So if we were to think about various models of research, we have shit, I forget. I drew a blank. Anyway, we have deductive and inductive reasoning. So what you're going to see on this slide is the concept of deductive reasoning. So deductive reasoning starts with a theory and works its way down like a funnel to hypotheses and research questions. What I blanked on briefly was the reverse, which is inductive reasoning. And inductive reasoning is the opposite, where we start with observation or direct data collection and formulate theories afterwards. But the vast majority of what we do is grounded in theory. So what are theories? So theories are general principles or statements that are designed to describe, predict, or explain behavior. And theories govern pretty much everything that we do. And from theories, we develop hypotheses. Now, hypotheses tend to be more in line of whatever the research question we're going to ask is, or the topic we're interested in studying. But the hypotheses stem directly from a theory in deductive reasoning. Now, sometimes we're going to make a hypothesis that is meant to challenge a pre-existing belief. So we might pit one hypothesis against another. Sometimes we're going to use hypotheses as a way of generalizing the existing research. So, but in general, as I said, it's like a funnel. We start with a broad theory, we develop hypotheses, and we formulate research questions on the topic. Now, a research question can be a formal or an informal research question. A formal research question is one where we know what we are expecting, whereas an informal research question is more vague. And that's typically used, as on the slide, when little is known about a topic, because you can't ask a directional question or hypothesis if little is known about the topic. Okay, so the first model of research that we're going to talk about are observational strategies. And observational strategies come in many forms. So we talk about the idea of naturalistic and systematic, aka structured observations. We talk about self-reports, and self-reports can be in a clinical interview, a structured interview. Self-report can be a survey that you administer. We talk about psychophysiological methods. We talk about case studies, and we'll talk about ethnographies. And when we finish this, that will be our framework for common observational methods, and then we'll move on to the concept of a correlation. Any thoughts, questions, reaction so far? All right. So let's talk about the idea of a naturalistic or structured observation. A naturalistic observation is used where you go into the general natural environment and you observe. And you observe pretty much everything or anything to see what's going on. Now, naturalistic observation has been used for a long time, especially with sociologists and anthropologists. So if I wanted to understand the values of a new culture, let's say we discovered a new island and it's inhabited, but we didn't know anything about the people on this island, we might engage in naturalistic observation. And naturalistic observation, we would go to this island, let's say maybe 6 months to a year, and we would take notes every day in our field journal to get a sense of what the rituals, practices, beliefs are of this community. Now, naturalistic observations are done, as I said, maybe 6 months, a year, because we typically don't know very much about this community. So we want to be there for a relatively extended period of time to get as much information as possible. So that's naturalistic observation. Now, because it's an observational strategy, we are not trying to alter behavior in any way. We're just trying to observe the behavior as it naturally occurs. Now, so if I am observing behavior from afar for 6 months or a year, the nice thing about naturalistic observation is that you're going to get behavior that reflects everyday life, right? Because you're not trying to alter it in any way. Now, one of the issues that you will face is that you have very little control over what happens in the environment. So you don't have much control over the conditions. We also know that the person making the observations has to be very careful to check their biases at the door. And some of the results of a naturalistic observation can be skewed based on one's past experience. Now, I said a naturalistic observation is typically done where you know very little about a topic. The more you know about a topic, the easier it is to structure it and focus your observations to certain target behaviors. So when we talk about a structured observation or a systematic observation, we know more about the topic. So we don't have to observe everything and take note on everything. We might focus on 1, 2, maybe 3 target behaviors, and that would be that. We also can use structured observation in a lab setting. For example, when we're doing research with children, it's not uncommon to have a one-way mirror in which you might have a child in a playroom and you observe how they play. Now you're on the other side of the glass, the child doesn't see you, but you can observe without that influence. Additionally, if it's in a lab setting, you have more control over the environment, right? I said in a naturalistic observation, you don't have as much control over the conditions or the environment. So we do have to be mindful, though, that when you're collecting data in a lab, it may, by definition of going to someone's lab could alter how one performs a little bit. And we have to ask ourselves, is it possible that our structured observation differs from if we were to observe in the real world? And we're going to talk later about the concept of reliability and validity. But the question that I'm asking with this last bullet point is idea of generalizability, whether or not these findings can be extended outside of a lab setting or outside of whatever environment you're looking at. So when we're making observations and we're collecting data on behavior, we have a decision to make. Do we want to take note of everything, the entire stream of behavior? Do we want to target specific behaviors? And if we're short on time, can we target specific behaviors in a limited amount of time? So I'll go through it. In the case of a naturalistic observation, more often than not, you're going to collect data on the entire stream of behavior. So if I know very little about a topic, as is the case with naturalistic observation, I don't know what's important and what's not important. So what I might do is take as many notes as possible. The problem with trying to collect data on the entire stream of behavior is that it is very hard to do. It is very impractical to do. So people can speak and act faster than you can write notes down. So you're going to miss things. And one of the things that some people use to help with this issue of the difficulty is to use cameras, whether they be visible cameras or hidden cameras. That allows you to collect data and rewatch the tape and make notes on the things you might have missed. But even if you have a video recorder, it still is impractical. It is very time consuming and very hard to write down everything that is happening. And then another challenge that we have to be mindful of is at the end of this observational period, you're going to have to create a code to find themes of what happened. And the more you've written down, the harder it is to analyze that qualitative data. So if we can, as much as possible, we want to be more focused, and we might want to engage in what's called event sampling. And event sampling, the researcher comes into the observation with certain interest in mind. I'm only targeting XYZ behavior. And because when you're making this observation, you're only interested in a select number of behaviors, it's a lot easier to score the data. It's a lot more efficient, but you can only go in with target behaviors if you know what you're looking at. So event sampling is used when more is known about a given topic or phenomenon. So event sampling would be used for more structured or systematic observations, whereas observing the entire stream of behavior would be more for naturalistic observation. Now, even when you are targeting specific behaviors, you may not have the ability to spend 6 months to a year in a community. So we have come up with an observational approach to address this as well. And we call it time sampling. Now, with time sampling, you take a window of time and divide it into smaller units of time. And you just ask yourself, did the behavior occur or not? So time sampling could be useful if you were a school psychologist and you were studying bullying, let's say, and you were interested in the concept of conduct disorder. So you might go to a recess And the recess, the children might go to the playground, I don't know, 30 minutes, and you might divide that 30 minutes into 30-second intervals. And by doing so, in that one recess, you're collecting 60 data points on the child versus it being one recess. So it is certainly the most efficient way to do observational data collection. But once again, you have to know exactly what you're looking for, and you have to target specific behaviors. And on the bottom of the slide, I give you an example where this could be useful. If you are working with a child on the autism spectrum, you might be interested in knowing how many times in a given hour that they engage in self-abusive behavior, whether it be biting themselves, hitting themselves, banging their head against the wall, things like that. So you would collect data, because if you were a BCBA and you were doing behavioral analysis, you want to know what the baseline is so that you can track the baseline, engage in some form of treatment, and then measure the effectiveness of the treatment. So in this case, dividing an hour up into minutes or 30-second blocks would be useful. In the case of recess, as I said, if you're looking for bullying, you would observe the child, let's say, and you wouldn't care that the child's pacing around or walking in the playground. The only time you would mark something down is if, let's say, the kid picks up a wood chip and throws it at another kid, or pushes another kid, or something of that nature. So time sampling is quite useful when you have limited amount of time. So the example of a school psychologist, where you might have one for a whole elementary school, you need to be pretty efficient. So time sampling is likely what they would use, or a BCBA in the case of autism. So, but as with all research methods, we have to understand that there are some potential limitations, potential biases. So one of the things we have to be mindful is, how does behavior change when a person is being observed? And typically we understand that when a person is being watched, their behavior does change. For example, if I were to ask you if you ever pass gas, everybody in this room would say that they do. But are you more likely to pass gas in the privacy of your home or in a classroom setting? I would bet that you're more likely to pass gas at home, because you're less worried about other people observing or judging you. Now, everybody passes gas, but all of a sudden, being in a classroom setting, your behavior changes. So we do have to be mindful in research to a similar idea, that when we observe a person, their behavior is going to change. We have to be mindful of that. So how do we deal with this? Well, one way to deal with it is to give time for the person to get comfortable, or the group to get comfortable, and build an adaptation period. Because once a person gets used to you as an observer, they will let their guard down. They will become more relaxed. That's perfectly normal. Or you can appoint someone from the community themselves or the natural environment to do the observing, where there's less reactivity. So when we talk about the observer influence, we're worried about reactivity and the concept of demand characteristics. Me observing you pulls something out of you. Okay. Now, that's on you, the person who is being observed. But we also have to be mindful, like I said, that the observer themselves can have bias. So I said to you that it's possible that, based on my past experience, I may look at something a certain kind of way. So when we have an experimenter or observer, we have to worry about the researcher themselves having their own bias. So one thing you can do in order to get rid of an experimenter bias is to appoint a second set of researchers. Let me explain. The first set of researchers might design the study, develop the hypotheses, and assign people to groups. Whereas the second set of researchers collects the data without awareness of, who's in what condition or whatnot. So if I was a researcher who had an agenda to push a certain outcome, I'm less likely to skew the results this way. So a double-blind procedure, you're having people do data collection that don't know what the hypothesis is. So that happens with larger research teams. Okay. So that is the observer influence. Now, we also have to be mindful that when we observe a person, all we know is the behavior that's occurring. We do not know what's going on underneath the surface, what the thoughts or emotions that were driving the behavior are. All we have is the behavior. So these are some of our limitations as it relates to naturalistic observation and systematic observation. So now we'll shift gears to another observational strategy called self-reports. And a self-report is where, as it sounds like, we ask a person to provide us information, and they're providing information about their personal experience. And one of the issues, as you will see on this slide, is honesty. But there are two general ways and I'll actually change that. There are three general ways that we can do an interview. As psychologists, we typically use what's called clinical interviews. Now, there are people who use structured interviews, and there is a concept called semi-structured interviews, which is a blend between the two. But a clinical interview allows you to ask a client, hey, what's going on? What brought you into therapy today? And then the client is going to take the lead. They're going to tell you, I'm struggling with being able to sleep. I'm super nervous. When I have dreams, I have nightmares. And as they're giving you this information, you're going to ask follow-up questions based on their responses. So it is designed to be unstructured. It is designed to be almost like a conversation where it's casual and I will go wherever you lead me, right? So what's nice about a clinical interview is that you allow people to share their experience, how they experience it. You also, with clinical interviews, get a lot of information in a relatively short period of time. When I take on a new client for therapy, I tell them that the first 2 to 3 sessions, I'm just getting to know them, in which I go through a clinical interview process. And I give myself 2 to 3 sessions because I don't know what you're going to say. And when you say it, I need to be able to dive deeper. But when you think about it, 2 to 3 sessions is roughly 2 hours and 15 minutes if you have 45-minute sessions. That's not a long period of time to be able to know about one's home life, one's schooling, one's occupational history, one's romantic history, substance use history, mental health history, developmental history, and so forth. Like, you're going through all these domains, and within a couple hours, you can paint a picture of who this person is and their lived experience. So the clinical interviews are very, very useful. You get a lot of information relatively quickly. As I said, some problems is honesty. If you watch the medical show House MD, House says everybody lies. And we know when we ask questions about sensitive topics, people are more prone to misrepresent the truth. We also know that the idea of social desirability is relevant. Everybody wants to be viewed in a positive way. Everybody wants to be liked. So it is possible when we ask a question, the response might be more based on what is socially acceptable versus what one truly believes. So we have to worry about honesty. And as I said, things that are taboos, if you ask people about their sexual practices, if you ask people about their substance use, if you ask people about their level of religious practice or adherence, these are good examples of when a person might lie or misrepresent who they are. We also know that if we are doing clinical interviews, there is the possibility of distortion, right? So if I were doing an interview, I was working with a child, but I got information from the parent as well, and I ask a parent to tell me about their child, most parents are going to report more favorable behavior than is true, because parents are biased. Parents generally want to highlight the strengths of their children. So we have to be mindful of that. And we also have to be mindful that the way we ask the question could elicit a specific response. So if I asked the question in a different way, maybe I would have gotten a different response. So that's clinical interviews. But the general principle of clinical interviews is that they're meant to be free flowing. We also have a concept called structured interviews. Now, with a structured interview, every person is being asked the same set of questions in the same way. And what's nice about a structured interview is that you don't have to worry, did I ask the question in a leading way or a biased way? So it eliminates certain biases based on how you ask the question or how far you went down a rabbit hole pressing for answers. Also, because you come in with a pre-listed set of questions, the structured interviews tend to be faster. You're only going to ask the questions that are on your sheet. You're not going to ad lib. So these are the strengths of a structured interview. Some of the criticisms or limitations of a structured interview is that you don't get the same level of depth. With a clinical interview, you get to ask follow-up questions and go exactly where your client is leading you. With a structured interview, you don't ask those follow-up questions, so you don't get the same level of depth. And oh yeah, the issues of inaccurate reporting are equally relevant here too, because again, everybody lies. We have to be mindful that whether it's a structured question or whether it's an unstructured question, people are going to misrepresent. Now, what do we do in therapy practice? The truth is, we operate based on the concept of more of a semi-structured interview. And what's the difference between a structured and semi-structured interview? A semi-structured interview, we have certain target questions we are going to ask everybody, but we allow for those follow-ups that you would have in a clinical interview. So the semi-structured interview gives you the best of both worlds, having some baseline target questions as well as the ability to follow up. So most of us use semi-structured interview processes. Now let's shift gears. We talked about Observational strategies. We talked about various interview methods. Another form of an observational method is psychophysiological methods. And what a psychophysiological method does is it links your mental state or behavior to some kind of biological or physiological response. And there are many different psychophysiological methods we use. For example, the galvanic skin response is a measure of sweating. And what do we know about sweating? Are there any mental health conditions we might be able to detect based on excessive sweating? Anyone think of a condition that a person might sweat a lot?
When they're anxious.
When they're anxious. So yeah, excessive sweating might be linked to an anxiety-based disorder for sure. An electromyogram measures muscle tension. Now, muscle tension happens when we're anxious as well, but it also can happen when a person's not telling the truth. So if you have ever seen a lie detector test, believe it or not, the lie detector test combines the galvanic skin response measure and the electromyogram measure. So we can detect truthfulness. Now, the validity or credibility of lie detector tests has recently come into question because sometimes people might have an off response even when they're telling the truth. So in forensic cases, even if they're done, the data is taken with a grain of salt. Now, an EEG, an electroencephalogram, measures the firing of neurons in the brain or the electrical activity in the brain. Are there any conditions you might be able to detect with an EEG? Let me see if I can call on someone. Abigail, can you think of a condition that would reveal itself when you're measuring the firing of neurons in the brain or an EEG?
Personally, I really can't think of something, but like when it's like the brain, wouldn't it be like also when like can it be also with an anxiety or something like that?
In principle, it could be, but that's not, you wouldn't use an EEG for anxiety. You would use it for other conditions more readily. How about you, Bayan? Bayan, are you with us? Fan? How about you, Fan?
Sleep disorders.
Excellent. Good job. So a sleep disorder, we know there is a disturbance with the electrical waves, right? So when we talk about aspects of sleep or sleep patterns, a person is going to have a disruptance in one or more sleep patterns. So a sleep-related disorder, you might link it to post-traumatic stress disorder. You might link it to seizure-based disorders. There are a lot of things you can use an EEG for. Now, I see a question, is it used for depression? Not typically. We wouldn't use an EEG for depression. A lot of the behavioral questionnaires would be sufficient to detect depression. Now, an MRI and a CT scan are still or static images of the brain. So what you get from an MRI or what you get from a CAT scan is a picture of the brain. And you might have imaging of the full brain, whether it be coronal slices or horizontal slices and so forth, to get different parts of the brain and to see certain disturbances. are there any psychological conditions you might be able to detect with an MRI? Let me see. Chastity, can you think of any conditions you might be able to detect with an MRI?
Would tumors be one or?
Well, good. A tumor is not a psychological disorder,
Right.
but yeah, we would use an MRI for tumors. How about a psychological disorder?
Would dementia count as one? I'm not sure if that would
Yeah.
relate.
The answer is yes, for sure. Now, we don't use the term dementia anymore. We use what's called neurocognitive disorders. That's the new phrase for the various dementias. And if you were to look at the most commonly talked about dementia, Alzheimer's disorder or Alzheimer's disease, right? You very well can see structural changes in the brain. For example, the hippocampus and the amygdala shrink. They oftentimes are smaller. And you can see that under a microscope. So you can see that in imaging. Now, I see George said schizophrenia, and then I'm going to go to Mohammed. I see you have your hand raised. What would we see in schizophrenia, George, with an MRI?
Sorry, just a minute. So basically, um, to be honest, I heard that this might be detected, but I'm not sure if there are like, um, aside from the mental like examination diagnosis, it might confirm this. So, but it's not 100% like.
Well, yeah, but what structure would be altered with schizophrenia?
Uh, I I would say occipital. I'm not sure.
It's actually the lateral ventricles. The lateral ventricles are the fluid-filled canals that go from the brain to spinal cord, and it has cerebrospinal fluid. What we see with schizophrenia is that the lateral ventricles, which almost looks like a butterfly, they become wider and it becomes larger. So with schizophrenia, we see changes to the lateral ventricles. Mohammed, you have your hand up?
Yes, Professor. I was gonna ask if we could detect depression with MRI.
No, I mean, an MRI is basic structures in the brain. What structures would be altered with depression?
Um, maybe hormones or something like that.
Can you see hormones in with an MRI?
I don't think so.
Exactly. Now, what you're all tapping into is that there's something also called a fMRI, a functional MRI. There's also something called a PET scan, positron emission form of a scan. Now, what they do is they can detect the activity in the brain. So it isn't just a picture of the brain and the brain regions. You're going to see various parts of the brain regions glowing in different colors. And the different colors are going to highlight various levels of activity in that brain region. Now, with that, you can detect all the things that we said. So with depression, we will see parts of the brain less active, right? We will see parts of the limbic system less active. So the glowing color of that area would be to a lesser degree. But a regular MRI, a regular CAT scan is a still picture. It's just a picture of brain tissue. So if you use an fMRI, you use a PET scan, you can certainly see pretty much anything. Yes, Mohammed, that's correct. fMRI is measuring blood activity. Okay, so what are the strengths of some of these psychophysiological methods? Well, one strength is that we're linking the brain structures to behavioral outcomes. So I don't have to rely on you telling me the truth, right? If I did a self-report measure, you could lie to me. But if I measured the activity in the brain, or if I gave you an EEG, any one of these things, I can actually say, well, this scan, this image, this test seems off relative to what we would expect. And the differences in brain structure or activity, or even brain chemistry in some cases, suggests some form of a mental illness. Another benefit of using psychophysiological methods is that you can collect data on nonverbal individuals. Babies you can do an EEG with. And a baby may not be able to tell you what they're experiencing, but you can still collect data. So there are benefits to psychophysiological methods. There are also some limitations. As you keep seeing, every research strategy, there's no perfect research strategy. Every research strategy has strengths and has weaknesses, strengths and limitations. So one of the things that we have to be mindful is that a physiological response can occur for a whole host of reasons. So remember how we talked about the galvanic skin response. So measuring sweating, well, people sweat for a whole host of reasons. For example, let's take a non-psychological disorder, obesity. People who are overweight sweat more typically than people who are normal or underweight. A person might sweat more due to temperature or clothing versus actual anxiety. So we have to be mindful that there are a whole host of factors that could drive a physiological response. We also have to be mindful that some of these measures could elicit anxiety in their own right. So imagine you did an EEG. Well, you have to put a skull cap on a person with a bunch of wires that are connected to a machine, and you're reading the activity. Being connected to a whole host of wires could elicit a fear response in its own right, not because you have anxiety disorder, but the equipment itself could stress you out. Also, things like MRI and fMRI, having a person lie down and do an imaging technique could be problematic, right? So if anyone has ever had an MRI or a CAT scan, you know that it's loud. And if you're claustrophobic, it could cause some problems too. So even when we're tapping directly into the brain and how the brain functions, we still have some considerations to be mindful of. So now let's talk about case studies. A case study is designed to be an in-depth analysis of an individual. Now, when we say an individual could be a person. So I might do a case study on Jeannie, right? I'll talk to you about Jeannie shortly. Or I might do a case study on an environment or setting. Or I might do a case study on a concept such as the 2008 market crash, right? You could do a case study on any number of things. But when we think of case studies, they are designed to be focused on the exceptional case, not the normal case, but an individual that's outside of the norm, right? So it's designed to be the most extreme or exceptional cases. So if I were studying Jeannie, as I said, I would mention she was locked away in her basement for over a decade, chained to a chair, with a bedpan next to her, and fed food on a tray with no social interactions with others for over a decade. And what happened was she wound up being nonverbal. And psychologists worked with her to see if could you teach language at a later point in time. And the moral of the story is they worked with her for 4 years and she never fully acquired language. Jeannie is a good example of a case study because she's an exceptional person outside of the norm. We don't do case studies on people like you and me. It's usually exceptional cases. Now, if we're going to apply the principles of a case study to a major historical figure, we refer to that as something called a psychobiography. So we're applying psychological principles and theory to try and explain the life of an individual. So someone like Abraham Lincoln has had numerous psychobiographies written about him to try and understand how he became who he was and the resilience he showed in the face of failure, depression, and the Civil War. What psychological factors did he have that allowed him to be successful? That's who you would do a case study on. That's who you would do a psychobiography on. The average person, it's not designed to be used for. Now, what are the strengths of case studies? The strengths of case studies are that you get these rich, descriptive insights or depth about an individual. And you're allowed to, study a typical individual. So you get a lot of beautiful things about when things are not operating as expected. Some of the weaknesses are that, once again, the researcher may have their own biases, and that may alter how they write up their case study. And because it's an in-depth analysis of an individual, we cannot generalize beyond that individual to anyone else. We know a lot about that individual, but it sheds no light on other people. So generalizability is one of the biggest criticisms of case studies. Now, there is a form of a case study which is called an ethnography, which is, I would just say, it's a case study of a culture. So you're trying to profile or study the unique values and experiences of a given culture to see how they live. And similar to a naturalistic observation, you're going to take notes for extended periods of time. And the only difference between a case study as we describe it, which is an individual, now an ethnography focuses on the group as a whole and the group's values, practices, and so forth. Strength of this is that we get to be able to understand a person's culture in a greater depth, but once again, we have an issue with generalizability, and we have an issue with observer biases. So these are the descriptive strategies. So the next piece we're going to talk about is correlational strategies. So I'm going to segment that as its own video. So I'm going to stop the recording